member for Vancouver East.
Mr. Speaker, it's astounding that the Conservative government plans to determine the future funding for healthcare based on economic growth. This comes after the government has long promised an annual 6% increase. It is an outrage that the government would consider cutting its increase in half and threaten the stability of frontline healthcare services. And while this government is ready to cut future funding for healthcare, it has still not delivered on the promises made in the 2004 Accord. This week, the Health Council of Canada reported that 23% of chronically ill Canadians cannot afford their medications. This is why the government must uphold its current commitments and fulfill the promises of 2004, including a national prescription drug coverage plan. Now is the time to act on healthcare, not to cut its funding. Mr. Speaker, the provinces need leadership and accountability from the federal government to sustain our public healthcare system. So why are they backing away from the table, signalling that Canadians' #1 concern is not shared by this government?
The honourable member for Fleetwood.